Guys, it's really been a minute since I've come on here to talk to you guys about nursing. I don't know, I just felt inclined to come on here and just vent. I think, for a lack of better words, that's really what it is. I just want to vent. I came home, did some homework, took a shower. I'm probably real ashy right now. I don't really care. After this, I'm going to bed. If you see some stuff in the background, like, don't even mind that. I'm in the process of moving right now, so everything is like all over the place. But I'm gonna try not to cry because I really had a hard shift. I feel like a lot of people don't realize like how strenuous being a nurse is. Not to mention like all the lawsuits and everything that they have going on right now. Like one person getting sued or probably going to end up in jail for overdose and another one for pulling the wrong medication. And constantly, like even when we're in nursing school, they emphasize like how much we should really document everything in real time, everything that happened, mostly for the sake of our licenses, because God knows nursing school is not easy. It's probably one of the hardest careers or hardest schooling to go through, considering that you only have about like 2 years of undergrad or 2 years of schooling, and then after that you go straight into the field the next 2 years before you graduate. But long story short, i I don't know how people were nurses or are nurses for like 30 or 20 years at a time. Like, I am not even fully 3 years yet. I'll be 3 years in November, this coming November. And I'm already like, yo, I want to tap out. Like, the shift that I had today, the system is like real funky right now. I low key kind of feel like we got hacked, but we're still trying to figure out that little situation right there. So that being said, we got to be overriding patients. And I personally, I was charged, but I felt very unsafe in that setting. At that point in time, it's like we literally got to survive. We literally got to get through these, next 12 hours for the shift. A new patient comes, a patient is not in the system, so you got to manually put the patient in there. And you got to make sure that the medication that you're taking out of the Omnicell or the Pyxis is for that actual patient, basically exercising the five rights. Um, what else was there? Like diet orders are wrong, um, patients being rude, or the family members, most of all, being rude. What else? Patients being inappropriate. You gotta call security, and not to mention being charged and having patients at the same time. And I hope that at the end of this video, like, I'm not gonna discourage anyone from becoming a nurse. Like, if that's what you want to do, then by all means, please do that. But I just feel like, I just personally feel like I'm getting to a point where nursing is, it's not end all be all for me. Like, I will not be in this profession for 30 years at a time at all. It will not be me. After the day that I've had, I do not see myself, like, if I'm in this profession for the next 5 years, it's going to be my fault that I did not execute or put everything in place that I said I was going to, because this thing is really taxing. And again, just to reflect back on all those lawsuits and all that stuff that's going on right now, like, this thing is not a freaking joke. Like, you spend all those years, you spend all that money on nursing school, and they'll take it away from you like this. Literally. And a lot of them really don't care. Kind of like if you're watching the news right now, or even if you're on social media, this recent story where this doctor decapitated a baby, and they're trying to say that the nurse is somehow involved because the nurse did not tell the doctor to stop. Like, first of all, we all know that some of these doctors don't listen to us nurses. So let's be real, that's neither here nor there. I'm not gonna sit here and act as if some of these nurses aren't really like, you know, some ish, but On the flip side, like when the doctor is wrong, the doctor is blatantly wrong. Okay? Um, I don't know. Like after literally after the day that I had today, I felt like just coming on here and just talking because I feel like a lot of people, yeah, they want to be nurses, especially with COVID. Like I'm not gonna sit here and act like I didn't make money off of COVID in the sense that the travel assignments were definitely A1. Because don't get me wrong, they were. But for what it's worth, there are times when I have to question myself and say, yo, is this risk really worth it? Like, is the money really worth it? Because this thing really plays on your mental. Like, I'll have one patient that's passing, and again, a lot of times on the unit, I'm charged. So there'll be a patient that's passing, and I'm trying to coordinate that with the primary nurse to make sure that she or he has everything that they need. On the flip side, I'm also going in to sort out another issue with another patient because that patient is unhappy. Another side, I'm probably like trying to handle my own patients in addition to do other charge duties on the unit at that moment in time. And of course, if I can't do it, I can't do it. I'm not going to overexert myself. But if it's a situation where I'm like, all right, let me just go ahead and try to do this. Of course, medication still got to be given. Okay. Antibiotics, of course, probably one of the most important medications out there because it's timed. But at this point, I feel like I'm at a place where if the medication is late, it's late. Like, I'm not gonna overexert myself. Like, y'all don't understand. I wish a lot more people would talk about like the stressors of nursing instead of just making it seem like, oh yeah, like it's really I'm not gonna sit here and act like it's not a bad, because when you're really set up right in nursing, it is really good. It's really rewarding. And again, COVID and these travel assignments, very rewarding. However, on the flip side, you are stuck in a place where, or some people, I'm not saying you, some people get stuck in a place where you have to navigate between the motions. And when I say that, I'm basically referring to some people becoming numb to emotions or some people becoming numb to death. Because I know recently for me, I had an aunt that passed, and she was somebody that I was close to. Not all the way close, but I was close to her. And my dad told me that she passed from cancer. And me, a nurse, I'm always seeing cancer, I'm always seeing death. And I'm like, oh, okay, it's a part of life. And my dad literally said to me, like, oh, you didn't call me or anything to check up on me? I'm like, oh, I didn't really think about it. And I genuinely didn't. I wish it was a lie, but it's really the truth. Like, a lot of times you get so used to death, you get so used to like something happening to the patient, you know that it's literally a cycle. Like I tell people on the unit, because I work on an intermediate care unit right now, I'm like, either I send you home, either I discharge you. It could be to home, it could be a skilled nursing facility or rehab, whatever the case is. I can discharge you, or or I can send you to the ICU, and then that could be another situation. Or we can do hospice or comfort care, and then you pass on my unit and we send you to the morgue. So again, I just wish a lot more people would talk about like how mentally and physically taxing nursing can be. There are days I'm like, yo, this isn't worth it. And today genuinely was one of those days because I was at work, and I feel like I'm getting emotional. Um, I was at work and okay, I was at work. It was the end of my shift, and I was sitting down charting. And again, I was charged today. I was coordinating everything on the unit, and you know, coordinating discharges, coordinating admissions, ICU transfers, all that good stuff. And at the end of the shift, I finally had the time to sit and chart on my own patients. And I had 3 patients. We have 24 patients on the unit. I had 3 of that. There are 6 other nurses, so everyone else had patients. But we did have some empty beds. But anyway, the point of this story is that I was on the phone with my boyfriend at the time, and he asked me the question, so how was work? And I started to talk, and then at one point I was like, wait, give me a second. Like my eyes just started to well up. Like I wanted to cry, because in that moment, that was like the realization for me that I'm like, I'm not gonna be doing this for 30 years. I'm not going to be doing this for 10 years. Even if I do decide to be a nurse for, that many years, I should not be at bedside. Like, that is my vow to myself. I will not be at bedside for that long. Because, again, this shit is taxing. Like, real bad. Like, I was talking to him about it, and I was saying to him that the hardest part is when you're sitting there. And outside of being a nurse, like, yeah, being a nurse, you're helping people. You're trying to, like, come outside of yourself to overexert yourself to be in a medical setting to help somebody else get better. Meanwhile, your own health is probably being sacrificed, right? Like, outside of you being a nurse, you're still a person, man or woman, you're still a person. And I do feel like a lot of patients and a lot of family members, they forget that. And they are still like rude, obnoxious. Some of them are very manipulative until you have to put them in their place. And I'm like, I can't do disrespect. Like, I'm going to put you in your place. But needless to say, a lot of people forget that you're a person as a nurse. And they come off as rude, disrespectful, or ungrateful. Because case in point, one of the patients today, she came from the ICU, but she also has cancer. Like, she had a resection prior, had reconstruction done, but it's back and metastasized like all over bones, all that stuff. And call light went off, went into the room to help. Like, hey, how are you? Like, what do you need help with? And while she's giving out the instructions, she's like, oh, can you do this? Can you do that? And it's no, please, no, thank you behind it. And I'm like, I already know me and my facial expressions. Like, I had a mask on the entire time, but I already know me and my facial expressions. So I'm like, no. If you do want to pursue nursing, expect it to be a thankless job. You can resort to, let's say, working at a med spa. And even that has its stressors too. I'll be honest with you. Even that has its stressors. But you can resort to working as a med spa. Let's say you're in nursing school. You're like, okay, I want to get into, and again, what I mentioned is one to consider if you don't want to be at bedside. Because just to reiterate again, it's not it. It's really not. It's really not. Like, some people may know, but I got into travel nursing when I was 9 months as a nurse. Like, I started my first job as a nurse in November of 2020. And by the following November, actually, no, I got the contract at 9 or 10 months, I think. And then I didn't start until November. About November. But it was like 11 months at that point in time. It was like a couple weeks before I officially made my year as a nurse. And with the facility that I started at, it's a level 1 trauma center, but that place is freaking organized chaos. Don't get me wrong, okay? I learned a lot, but it came at a cost. Definitely came at a cost, okay? And I will definitely attribute that facility to the fact that I was able to start travel nursing so quickly. And of course, it was during COVID too, so who knows? Like, they probably desperately needed somebody at the time, and I was a perfect fit, so I'm grateful for that. But needless to say, I got out of that place at 9 months because I felt so stressed. It was a CV ICU step down unit. Okay. Um, Honestly, the family members and patients on that unit, some of them were bad here and there, but for the most part, they were too much in pain to even sit there and be rude to you. Like half of them came up on the unit with their chest cracked. You have drains below your sternum right there, like literally by your diaphragm. You got pain right there. You can hardly breathe. You literally got to call us for everything to pick you up. And at one point, I got to be working on night shift because a lot of people were leaving. So I'm like, okay, cool. So I ended up being able to make more money that way, even as a new grad nurse. Mind you, at this point, we're supposed to have up to like 4 patients. But on like towards the time when I left, we started having 5 patients. All of these patients have PCAs, all of these patients have drips, all of these patients have drains, all of these patients have SVG sites, IJs, they got the sternal pillows, all of them, you gotta weigh them in the morning. All of them, you also have to get them up and walking and out of the bed in the morning. 5 patients to do that with. You would want to spend like probably 10 to 15 minutes with a patient, but you can't really do that because their pain. Pain is something you have to consider for them, which is definitely going to be on a higher scale considering the degree of the surgery that they had. So went on, from that again into travel nursing, and eventually I'm at the facility that I'm at right now. And at this particular facility, they ended up matching what I was making for my last contract with them, so which I'm grateful for. But there are days I'm like, this ain't even worth it. Like, nope. Like, really, what's the point if you go into school and overexerting yourself for these patients, and again, in a situation where they're not even thanking you to do stuff, where they're often rude. Some of them, they're nice, don't get me wrong, but a lot of them are really rude too. They just tell you to do stuff and they expect you to do it, and it's like, oh, okay. No. And I do also think that a lot of them don't realize that depending on who the doctor is, if they trust the judgment of the nurse, the doctor will literally go to the nurse and be like, hey, the patient is saying such and such, what do you think? And if that nurse is a credible nurse, he or she will make a suggestion and that doctor will go by what the nurse says. Even though that nurse said it at first and the patient was like, oh, okay, but I want to hear it from a doctor. Okay, cool. But I'm going to say to the doctor, he's going to say to you. So, like you could have just listened to me in the first place. So, just that like cycle of things. And of course, anywhere you go in any profession, like you're always going to have your ups and downs. You're always going to have your pros and cons. But I just really think that today was a day of realization for me. Just basically bringing things into perspective for me, because I've cried before because of work, and my first time crying was basically because I saw a patient and I knew that she was scared. She was on trach vent. I knew she was scared to pass, and all the medications that we were giving her, like, it just wasn't helping her. So I cried because of that. But for me to cry because of, one, the shift, and two, I don't know, I just felt hurt by the whole thing, hurt by the whole, like, work situation. I was like, damn, like, this isn't it. This isn't life. Like, or maybe it's not more so like the nursing part of it, but more so like the bedside component of it. Again, just like I said before. And even if you do decide to explore, or even if one does, decide to explore a different side of nursing, just the fact that your initial says, or the letters behind your name say RN, it still leaves you liable to other consequences. Like, let's say years down the line, your NP or CRNA or whichever the case is, as long as you're the one that worked on that case, that still leaves you liable to any consequences or like court cases or whatever the case is. If something was supposed to come up later on down the line about a patient or about something that you worked on or something that you document or whatever, like you're just never safe in nursing. And I think that's one of the things also that contributed to me feeling as emotional as I did today, because that was also another realization for me. Like, again, bedside, it's not a bed of roses. Definitely not. So again, if you're considering like going into nursing, by all means, do it. You know, maybe you have a calling. Maybe you're like, okay, I want to do this and this and this. Like you have a particular timeline for yourself. But if it's just something that you were initially thinking like, oh, it's gonna be my end all be all, trust me, I really don't want y'all to think, you know, oh, she's only saying this because of the, no, like nursing is real. Like sometimes it can be a dog eat dog type of situation, depending on who the nurse is. Like you really genuinely have to network properly, because if not, people will really screw you over. Case in point, like in the whole aesthetic world, people gatekeep real bad. People really gatekeep. And then if you're an African American woman or a black woman, you don't really fit into the aesthetic. If you want to go to the ICU, if you want to go to the LND, it's going to be even harder for you to, you know, get hired for those units or fit into the aesthetic of those units, because they're mostly like Asian American women or Caucasian American women or like Indian women, but any woman of fairer skin tone. That's what I noticed. So again, if you want to pursue nursing, by all means, do so. But I guess I kind of wish that there was a video like this for me when I was thinking about doing nursing initially, just so I could have other options to consider. Some people may know I was pre-med before, and I definitely switched, and travel nursing definitely does not help the situation because you get used to a certain lifestyle. I still want to go back. I still think about it. I have the MCAT books literally like sitting over there. So, you know, overall, I still think about going back. I still think about like finishing my prerequisites and all that. I literally only have 2 prerequisites to do, and then I would have been okay to do my MCAT. But again, time, I keep thinking about the time factor. That's what my issue is. Like, you're going to be 38 anyway, so you might as well be 38 and a doctor, or 38 and regret it. So, but yeah, that's my little spiel. I said it to my boyfriend, and he knows. Like, I'm typically not, you know, an emotional person, but today really got me. And it also doesn't help that I'm working. Like this past week, I did 5 shifts. Yeah, I did 5 shifts. I have a goal in mind, so of course the shifts are available. So you go ahead and pick up. But to every action, there's always a reaction. Basically, could be positive, could be negative. For me, I know the positive reaction is that I'm getting the money to do what I want to do. But on the flip side, you could be tired, worn out. Like, all I know is that after this whole process is over, I'm gonna need a good little vacation. Like, I'm trying to stay away from liquor. I feel like my body reacts terrible to it, in the sense that my heart starts to race. I'm really trying to stay away from that. I'm really trying to stay away from like other components as well. So basically, like anything that doesn't serve me physically, mentally, emotionally, like my goal is at this point, and also again because of today, my goal is to find a way to navigate through that, find a way to navigate away from that, and to find something else that serves me, my mental and my physical, because you only have one life, okay? Literally. Being emotionless does not feel good at all. Being every other less, like I can't even think of that right now. Being emotionless, it just doesn't feel good. Being unempathetic, I don't even know if that's the correct phrase, but You know what I'm trying to say. Like, it just does not feel good. Or when somebody's looking for like sympathy or again just empathy, and you're like, oh, I'm sorry, and you just keep it pushing because you get numb to everything. Like, you literally get numb to all of that. And I don't want to be that person. Like, I don't want to be that person that's like forced to be working all of these shifts or can't go on a vacation, whatever the case is, because they want to do a shift, or they can't go because of, no PTO. Or we all know about the whole politics of staff nursing at this point. But needless to say, if you want to be a nurse, go ahead and do it. But just don't let it be an end all be all. That's all I got to say. Have another option. Have multiple options, if that. Or just have something in mind to say, okay, I'm going to be a nurse for this amount of years, and then I'm going to use this to be a stepping stone to something else. Don't just sit there and just get comfortable, because you can get wrapped up in some BS in nursing real quick, especially if you're not careful, or if you just wrap yourself around the wrong people. Definitely network. Nursing is definitely a field to network in. Any little conferences, any little workshops or symposiums, go ahead, go there and meet somebody. You could end up in pharmaceuticals, aesthetics again, whichever the case is. Just don't let nursing be your end all be all. Okay? That's all I gotta say. I'm about to go to bed. I'm tired. I work tomorrow. Right now it is 12:20 a.m. and then I'm in the East Coast. I gotta get up at like 5:45. I left my truck at work because I dead ass called my boyfriend. I was like, yo, please come pick me up. Like, I cannot. I was not in a mentation to drive right now. But yeah. Take what I say with a grain of salt, but also consider it, because of course these are my opinions. I'm just giving you my opinions. You can take them if you want, you can leave them if you want, but it's just something to consider. All right?